We're starting our afternoon with a fireside chat with Secretary Sudders and Steve Walsh. Now, I'd like you to use your imagination. Fireside chat. Behind them is a fireplace, and it's nice, and it's warm, and it's just beautiful, and it's really shedding some beautiful light on them. You've met Steve already, and I think Secretary Sudders needs no introduction, especially in this room, but I will give her one anyway. Serving as Secretary of the Executive Office of Health and Human Services for the Commonwealth of Massachusetts since 2015, she oversees 12 state agencies and the Mass Health Program with a combined budget of $26 million and 22,000 employees. And I think as you all well know, she has been a lifelong advocate for behavioral health through her training and work as a social worker, including her earlier role as Massachusetts Commissioner for Mental Health. So I will turn it over to Secretary Sudders and Steve Walsh.
Thank you very much, Jackie. Thank you. It's good to be back with you after the morning program. It was April 2020, and the Secretary and I had been talking every day for about a month, and my 5-year-old at the time, I said, Daddy's got to take a work call, and I hear from her from the other room say, he's talking to his special friend Marylou again. I never called you Marylou, by the way. Now at age 8, she just says, shut up, he's talking to the Secretary. So there's two things about that are takeaways for me. One is you're a special friend. And we've done a lot of work together, a lot of really good work. The second is my daughter's a handful and will continue to be. But that's not what we're here to talk about. As you all know, Secretary Sudders' his career has been about putting people in her care, right? As a social worker, as a behavioral health advocate. And then she made the decision to join this vocation and put the Commonwealth in her care. So I wanted to talk a little bit about what that meant to you, that calling, being a social worker, and how you've approached the job as secretary through that lens.
Can I hit this button?
You're on.
I'm on?
No, hit it button.
See, my special friend didn't tell me to hit the button. So first of all, it's always good to be with all of you. This is actually a very special place, and I don't know if it came out earlier, Josh, that the first BBA Summit on mental health was in this room, how many years ago? 25 years ago. So we've had many a behavioral health summit in this space in our journey together. So as I think of coming inside of government, having been outside of government, and having been actually involved in lawsuits against the Commonwealth of Massachusetts, and then inheriting the lawsuits that I helped be an expert on, it is to take one's advocacy internal. Always being true to your core, like what is in your heart in terms of, for me, thinking about health care holistically. I know we use the term now whole health, but for me it was always mental health and behavioral health was always so segregated from physical health, and we talked about it in very segregated terms of really trying to take parity and really making it real for individuals, families, kids, and all of us. So that really was my true north was as secretary when I talk about health. Some of the people who work for me who are here know I used to use a term, the ENTLs, dental and mental, and how they're still nodding their heads. And I was like, I want to just eradicate that. And when we talk about someone's health, we're talking about behavioral, medical, and oral health. And that's really what has driven me 7 years and 8 months, but who's counting? And a pandemic in the middle of it.
And a pandemic in the middle of it. And let's go to that in a minute. I know there's some CEOs in the room that talk to you at that point too.
Every day.
Every day. And I imagine that a lot of people would mirror this thought. The collaboration at that time was unlike anything we've seen. Can you just talk a little bit about working with folks so closely and the profound relationships that were developed over the pandemic period?
Well, I'd be surprised if there's no one in this room who doesn't have my cell phone, maybe outside of a few reporters, perhaps, of which those folks have said, could you please call my comms department? it's been a devastating period for all of us, individually, our families, collectively, economically. Having said that, I have to tell you, there is no other state I would want to be in than in the Commonwealth of Massachusetts throughout this pandemic. Throughout all of the challenges, and there are many, and there are far too many people lost their lives and have long COVID, our healthcare system and our human services system really acted as one system, collaborative, not competitive, and just that can-do spirit and attitude that makes Massachusetts nimble. This has been my home for 50 years. I talked to my counterparts in other states, as I was talking to Steve and many of you every day. I was also having conversations with my counterparts or whoever their COVID lead was in other states. And I remember getting off of them and being sort of, in all fairness, having the same anticipatory anxiety as all of you did, particularly in those early days of we just didn't know what was next and next and next. And trying to manage that for the Charlie and Marylou show that many of you got to watch at noontime that I think we interrupted Price is Right or something. But I would talk to them and I would get off the phone and say to the governor, we are where we should be because of the collaborativeness of Massachusetts. We're back a little bit to the competitive stuff, but there's still this really a shared responsibility that we were all in this together. I'm sure others, have their own perspectives about this, but I'm looking at Assad, since I live in Cambridge, and all acute care hospitals are all my favorites. I'm very clear about that.
Are you sure about that? I don't know. I've got some calls.
But, PPE, right? My favorite four-letter word. You can take it. You can figure out what that means. But the sharing of everything, information, right? Patient loading. It's a term I don't really like, but right, transferring patients is necessary. If there's a silver lining, telehealth. Massachusetts was probably the innovator of telehealth in the United States, and we were a little bit of a slow adopter. In 7 days, I was at South Boston Community Health Center last night, and in 3 days, they pivoted all of their behavioral health work to telebehavioral health, right? Not perfect. All of us would agree, you flip a switch, things don't happen perfectly, but telehealth, telebehavioral health is a credit to you being committed to serving your patients, your families. And thanks to the legislature, we did that as an emergency order. Had some interesting conversations with the governor to ensure that we would do it with parity for in-person and telebehavioral health, because we wanted to, for me, as a social worker, I wanted to convey to someone who is having a telebehavioral health visit that the quality, that this was not a lesser service, that was quality care being provided to you. And that's why the parity for telebehavioral health and telehealth for me was so important. And I see Representative Decker here, and I'm sure there's other legislators here. I have my glasses on, so I can't see to the back. That the legislature, certainly for telebehavioral health, has made that in perpetuity. And I just want to thank the legislature for their collaboration.
They certainly have been great. I know we're hearing from the chair later and some of her colleagues. And one of the things about these calls that was remarkable, and Dr. Churchwell remembers this regularly, is you didn't talk, you listened. And we went around, right? And we started in the West, and people talked about what was happening, and you were hearing them. So shifting to today's focus, what are you hearing now about pediatric behavioral health? How has it changed? What are you seeing the challenges that our providers are facing out there?
So here's the positive change. I'm going to be a little glass half full, and then I'll do the glass half empty piece. So when I started the journey of, when I was commissioner, of really promoting parity for mental health, I remember being in a lot of forums as a social worker. It's important to listen, and pediatricians and primary care doctors, and I was promoting screening. Right? If you don't screen, how do you know? And I see some heads nodding from my friends from the Kids Mental Health Campaign. And in every one of those forums, and I appreciate the challenge, primary care doctors would stand up and say, but if I screen, I need to do something. So then what? And so I would do but if we don't screen, we won't know what to do next. And in fact, we passed a law in Massachusetts that for children, part of the primary care, right, part of your annual visits includes screening. So we've established, I think, how important behavioral health and mental health is for children's growth. I think that's the positive we build on. The challenge is the workforce. The challenge is the workforce. All of you, everyone, we have such throughput issues, from hospitals to finding a clinical social worker to staffing our health and human services programs. We had a workforce challenge before in certain segments in health and human services before the pandemic. The pandemic just, I don't even know what the word is. I mean, it just exploded in terms of the workforce challenge. And that is, I think, the challenge and the opportunity that we need to address together.
You mentioned a little bit that's happening.
I'm still waiting for the fireplace, by the way.
IT's working on it. We'll have it up in any minute. Our members and all those in the healthcare community have really been praising the roadmap. Can you just talk a little bit about what its promise might be and what you hope to see come from it?
Thank you for that. So first of all, probably every person in this room was part of, we have a way of exhausting people in process on occasion in government, but I say that in jest, as people who know me know, I take all that we do seriously. I can be slightly irreverent, was to listen to what the needs, the challenges were, which is what created then a roadmap. And I also knew if we said the mental health system, it would be completely overwhelming to everybody. I'd be like, well, we have to change the entire mental health system. Well, we probably do. But we started with the front door, right? So reimagining access for families and individuals, not having to be informed if you have a need to go to an emergency department. Of course, we want you to go to an emergency department if it's a crisis, but to really reimagine what that could be, opening up access. So there's really, for me, three key elements to it. One is a 24/7 clinical helpline, not to be confused with 988, a clinical helpline, so someone could call regardless of insurance in the Commonwealth of Massachusetts to get a clinical assessment. And then 25 designated behavioral health centers, which have been announced, and I'm really pleased to tell you that 23, 24 of them are in, everyone is in their development phase, and there's always somebody who has a challenge with a physical location and construction. I never thought I'd be in the door business trying to help somebody find doors for a building, but they're all in development, so they've been named. So the 24/7 clinical line, 25 designated behavioral health centers, and a much more robust community crisis service, one that I was actually quite familiar with years ago when I was Commissioner of Mental Health, that over time, for lots of reasons, is not as mobile and as community-based as it should be. So those are the three elements. Next week, we will announce the helpline, the clinical helpline provider, and then soon thereafter what that phone number will be. And we will start to message very soon about the elements that will roll out in early January. And I want to thank the hospitals, and I want to thank the legislature. I'm thanking the hospitals this morning because the bulk of emergency crisis work has been in hospitals. And with the enactment of the ABC bill, which has lots of extraordinary components in it, I think we will, in this next year, which I will be watching, and I live in Massachusetts, so I'm not going far, to ensure that the roadmap and the ABC bill rolls out the way we all intended to. So that's.
And if you had a little more time, what are the next steps beyond?
Who says I'm going?
Well, that's the next question.
I'm here till I'm not,
Well, you've been pushing so hard for so long on so many areas, and there's so much of it included in this legislation. What else should we be thinking about and working on in the new year? What would be the next steps, the 2.0?
All right. So it's not loan repayment for behavioral health. It's paying it forward.
Yeah.
It's paying for people's education. If we want to have a diverse workforce, understanding that in behavioral health, and I'm talking now really like social workers and nurses and peers and mental health counselors, and like we can have this debate as to whether everybody should have the same salary in the United States. Good luck in that conversation. But we know that social workers, I'm just going to use social workers because that's what I am, we will never be reimbursed at the same rate or paid at the same rate as perhaps an orthopedic surgeon. Again, someone else can have that debate as to whether it should or whatever. So, but if you pay for someone's education and ask them to then work in the private nonprofit or the public space or where there are shortages, that allows someone to work in that space rather than perhaps going into private practice. I use me as a case example. My social work degree, my social work education was completely paid for by the federal government. It predates HRSA, that's how old I am. And it was called a university-affiliated grant. 2 years paid at Boston University School of Social Work. The requirements were two things. One was my field placements were had to be in a private nonprofit or a public setting, and I became completely, I came to just believe in the power of working in government. So both of my placements, well, 1.5 of the placements were in the public sector, and the other half was I was in a hospital in a community setting. And then the other commitment was for 1 year of training was a sort of a moral obligation. I didn't have to even sign anything. Would be 1 year for every year paid in the private nonprofit. Well, here's your poster child. I can't remember how many years I've now worked in the public sector, or the private nonprofit sector, right? And by coming out of graduate school without debt, working in the private nonprofit in the government space was affordable for me. I appreciate all the work that the legislature has done on loan repayment because it's important, because that's, right, we need both though, not one. And to build a pipeline, and I think also what that does is it connotes societal respect of the work. We're investing in you to invest with others. So if I had a 2.0 coming out of the gates on workforce, that would be the one that we put together. And I know what people say, well, what do you do about the outliers? But the last time I looked, you write policies for reasonable people, and then you deal with the outliers, right? You don't start with what are all the things we need to mitigate against. You start with what's the right thing to do. And then I have other ways to describe it, but since we have some videos and TV cameras, I won't use my French on how we manage that.
Just staying on the
That's one I would do.
Well, it's great, right? If you don't have, there's no forgiveness if you don't have the capital to get there. You talked about the workforce. I've heard you spoken passionately about it. How do we attract people back? I mean, it's a really difficult time in healthcare, particularly in behavioral health. There is a crisis. That feeling of vocation is sometimes lost. What do you say to the young person who's looking to go into this field that might be able to do what you did and walk in your shoes?
I'm not sure I'd recommend anyone walking in my shoes over these past 2.5 years, no offense, but, well, that is why, so I think language is important. And some of you we've had some of this in a more intimate basis than in this large room with, if we keep talking about, somehow we need to find the words to shift from crisis to opportunity to serve. And I am not the marketer, we all know that. I'm not the best wordsmith person. But if we keep talking about it as a crisis, unless you're someone who has that adrenaline rush of wanting to work in emergency rooms or with ambulances, right? I mean, like that kind of, yes, there's a few people in this room, right? But somehow we have to flip the language so that people don't feel like they're coming into a crisis, that it's this extraordinary opportunity to serve in a profession that we value you such that we're going to help pay for it. And I think that's got to be part of the messaging, Steve, because I am a little worried. I mean, I'm sitting here talking about the workforce crisis, that if we keep crisis, unless, I mean, I'm looking at physicians, like now everyone's an emergency room doc, right? Right. So people work in emergency rooms because there is a certain personality, adrenaline rush, right? That is their passion. But that's not all of what is mental health work. It shouldn't all be based on this crisis. So I think part of it is reframing the conversation on what are the opportunities for, as you would say, roadmap 2.0 or whatever words people want to use. I think that's one.
Yeah, thanks. And I think this morning we remember Dr. Churchill let us off talking about that very thing, that it's not all crisis. It's a challenge, but it's an opportunity. And it's nice to see you both sharing those similar words.
And we didn't talk beforehand.
Yeah. Let's talk about your team for a minute, because you talked about it from the behavioral health perspective, but let's talk about the public service aspect of it. You really have a great team, and they're here. I mean, they're dedicated. None of us in the Commonwealth could have done this without them. Their service, their incredibly hard work, their long hours. How have you kept them motivated through a really difficult time? You're in the command center with, 30 people working around the clock for months and months and months at a time. How did you lead that team to do the things that you needed to do?
Well, I should probably leave the room so that they can answer the question. I have been extraordinarily privileged to work with, in government service as secretary, some of the most amazing public servants that you should all of us as taxpayers should be proud of. They could all make, and so I want them all to close their ears, they could probably all make a lot more outside of what they do. They're all mission-driven people. They have a couple of things, so I may embarrass some of them, and I don't. Two things when I have been recruiting people to work in government. Three things. One is I'm not looking for someone for a lifetime commitment. Right, we're stewards for a period of time. What I'm looking for is someone who has the expertise, so like the knowledge, the work, right? They know the work, they know the area of expertise, and they have really strong interpersonal skills. Because this work is difficult, it is challenging, it's tough, and we can't resolve every issue, but you can sit at the table and treat people with dignity and respect to try to find that common, is there a common theme? Is there something we can work together? I think what's held them together, and again, I should leave the room and they can tell you, is I'm very loyal. I think they would say this. I'm very loyal to the people who work for me, and I have their backs. And so I would hope they would say that when things get challenging, that I am always there to step in, not take over, but to step in. They'll probably say take over on occasion, to step in and to support them through whatever the challenge is. And I think that is, people will stretch themselves a lot, and they do each and every day. I think when they know that they have the support of the secretary. What's funny about being secretary is I never realized you lose your first name. Even last night at this event, I was like, Secretary Sudders, Secretary Sudders. It was Governor Charlie Baker and Secretary Sudders. And I thought, so what happened to Marylou? But I understand the role. So I think that's one. But truly, there's a bunch of them here. They're just amazing people. And, that's not how so much of the public thinks about government workers, right? And that's what we are. We're government workers. We use the taxpayer dollars. You all pay our salaries. I pay taxes too. I pay my salary too. But thank you for that. I do want to just give a shout out to, I think Representative Decker, I see her nodding her head a little bit. I think people would say we have really had a stellar group. And we don't always agree.
Clap. You can give them a round of applause. Give the staff a round of applause. Yeah.
So I'd also tell you, though,
Yeah.
they also know I'm a taskmaster.
I don't think, we've never seen that side.
I've never seen that. Right. Rumor has it I'm decisive. I've heard that about me.
Well, I'll tell you what you don't do a lot, and we're going to do it for the last couple of minutes here as our time together comes to a close. You've talked about the system. You've been fiercely loyal to your team. You've been very loyal to the governor. You don't do a lot talking about yourself. So can we spend a couple of minutes on what you're most proud of? It's been a long time, and there's so much that you leave a legacy behind, having accomplished on behalf of our patients. Talk about some of the things that you're most proud of before we close together.
So that's actually difficult because I think of my time as secretary as being a steward for a period of time. So much of this is a work in progress. And what I'm proudest about is a few things. I think we have framed health as whole health. And I don't think the Commonwealth, when they going forward with the next administration and certainly with the legislature and all of you, I think when people talk about health, we're not going to talk about health. And I remember when I was Commissioner of Mental Health, I'd say health. And what I mean by that is I will talk about health. And that mental health and parity will be real, and we will realize it, truly realize it. I think that is one. And two, that the extraordinary group of public servants that I've recruited and others will recruit, that I think people will see working in government is an opportunity to work in collaboration with with health and human services community, the private nonprofit, and families and individuals to we've created a good platform for the future. I think the 1115 waiver is a complete game changer. And I was reminded again yesterday that there was some messiness in some prior 1115 waivers, and I won't go into detail because it doesn't really matter. But the waiver now in Massachusetts going forward is now just the funding of it, the structure of it, the policies in it will be much more facile negotiations with the federal government going forward. And it's historic investments. And just a reminder, 60% of the Commonwealth's kids have mass health. So it is very, very important to children and families, and obviously with individuals of low income and people with disabilities. But 60% of our Commonwealth's kids have mass health, and we need to ensure that it's the best insurance for kids and their families in the Commonwealth. So I feel very good about the 1115 waiver. I feel very good. I feel good about the roadmap and where it's headed, and I will feel really good if we can take that next opportunity to really invest in the behavioral health and the healthcare and human services workforce by really finding some ways to invest in people's education so that they can find this to be really honorable professions. So thank you. And you know what? I'm still married after 8 years, and that's personally, I'm proud of that one.
I just will add to the waiver for a minute, and similar to my daughter Bridget, when I met Bradley one night, he said, well, now I can put a face behind the voice. So he heard me through the phone as well. The 1115 waiver, and I think most folks know, but for the first time in the first state in the country, will pay for outcomes based on equity. I mean, that is extraordinary work. Secretary, you've been very, very generous with your time, and I appreciate the opportunity to have people just have a casual conversation with you about some of the extraordinary accomplishments that you have done over your time. And I do hope that you are here for many years to come. It's not often the way politics work, but it's still a possibility. But indulge me this for just a minute. You have done more for our behavioral health system than any other secretary in the history of the Commonwealth. And I think we should show some gratitude at this moment and give you a standing ovation as we send you on your way. So thank you.